Hello, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in the presentation, we'll talk about the paraffin wax bath therapy, in which we'll talk about the methods and various application of the paraffin wax bath. So first are the methods of paraffin wax bath. In this, the part to be treated must be cleaned by soap and moisture to be soaked by towel. Position of the patient should be such that the part to be treated come closer to the wax bath container. Before application, one must ensure that there should be no moisture on the body tissues, otherwise burn could occur. And the warm wax is placed on the body tissues by various techniques, and the treatment is given for about 10 to 20 minutes. Next are techniques of application. So various techniques used for application of various paraffin wax are as follows. So first is direct pouring method. In this, the molten wax is directly poured by a mug or utensil on the part to be treated and then wrapped around by a towel, and the wax is allowed to solidify for about 10 to 20 minutes. Several layers can be made over the body tissues. Second is brushing method. It is less commonly used method of paraffin wax application. In this method, 8 to 10 coats of wax are applied to the area with a paintbrush using even and rapid strokes. The area is then wrapped with towel for 10 to 20 minutes, and after this time, paraffin wax is removed and discarded. Third is immersion method. In this method of application, provides somewhat vigorous heating. The body part is treated dipped 2 to 4 times to form a thin coat, and then left immersed in paraffin wax for 20 to 30 minutes. A thin globe of solid paraffin wax formed slows the heat conduction, and the use of immersion method required cooperation and tolerance by the patient in a dependent position, and care should be taken to ensure that the patient is in comfortable position during the treatment. Fourth method is dipping method. It provides mild heating. The patient should wash and dry the part to be treated. The therapist instructs the patient to dip the body part in the bath and then remove it until the paraffin solidifies and thin layer of adherent solid paraffin is formed over the skin. Then dipping is repeated about 8 to 12 times until thick glow on a part. One thick glow of wax is formed. The treated area is wrapped in a plastic and then wrapped in a towel. If edema is concerned, then area may be elevated, and the effective duration of this treatment is 10 to 15 minutes. Next method is towel or bandaging method. In this, a towel or a roll of bandage is immersed in a molten wax and then wrapped around the body part. Several layers can be made over the body part, and this method is preferably used for treating proximal parts of the body. Thank you.